I always look so serious at the beginning of these webinars when I go back and look at the videos because I think I'm concentrating so hard to make sure all the tech's right. Anyway, welcome to this webinar. My name is Mary Thomas. I've been a physical therapist for more than 30 years, and for the last 20 years, one of my specialties has been swelling and getting rid of it, because swelling can cause a lot of pressure in the tissues. Sometimes people even say to me, no, I'm not swollen. And I remember a book that I read by a German physician that talked about how the swelling in our tissues and the fluid around our cells can actually increase by 30 to 50% before it even becomes visible. So we look at it and we go, yeah, but it looks fine. Even as a new grad PT, before I studied swelling and worked with swelling as much as I have over the last 20 years, I would have patients say, no, it's swollen. And I'm like, it looks fine. It looks fine. And I can even remember discussing this with other PTs that it was like, there's nothing wrong here. But when I began to study swelling and look at how swelling affects the body and how much swelling we can have, because if you have a 50% increase in that pressure around the cells, that's like putting 18 ounces of Coke in a 12-ounce Coke can. Can you imagine how much pressure it takes? And that's before the can would even deform. So you don't even know there's that much pressure, but imagine opening that can up. It would be, everywhere. It would be terrible. So, or at least I wouldn't want to be on the downhill side of that Coke can being opened, because, but that pressure inside our tissues can block our ability to move. We lose our ability to really move with fluidity and ease. And it also causes our capillaries, which should be open like this, and then we can get some things through there, right? But if I've got all this pressure on the outside of that little capillary, what happens is the capillary gets squished, and then it's really hard to get the building blocks that I need to my cells to recover and restore after a trauma, after an injury, a surgery, whatever it is. I can't get anything through that little tiny hole, or I get very little through that hole, or it goes really slow. So what I need to do is pop that back open. Now, I said a lot of this a week ago when I did the previous webinar, but I wanted to review that briefly before we got started, because in that video a week ago, which hopefully you were either here in this webinar or in that webinar, or you have watched the video from it, but we need to consider that swelling on a more specific level, because last week I talked really a lot about generalities of swelling. So we talked about water consumption, drinking half your body weight in fluid ounces every day. So you miss a day here and there, but every day. Number 2 was doing your breathing and doing really good deep diaphragmatic breathing. And I probably need to do a webinar on that in the near future, to spend some real time going into some depth about breathing. Most people say to me, oh, I breathe fine. Well, you breathe fine enough to stay alive, but you can utilize your breath in order to really get those fluids moving. And so that would be a really valuable webinar, because you can breathe all the time anywhere, right? And if you focus on how you're breathing, then and utilize it, you can actually maximize how much fluid can get moved in your body. So today, however, I'm going to focus on how can I get more specific than what we went into in the last video to really get some of that fluid that's been stuck in my tissues moving. And it is so important, and it is so valuable to get this fluid moving. One patient I had was sent to me, her kneecap had been fractured and it had been wired back together and was healed, but she couldn't bend her knee more than about 75, 80 degrees. And in one session, just getting the fluid around that kneecap moving and out of there, her range of motion went from about 75 or 80 degrees up to 120 degrees. And that was in an hour. We didn't do any exercises yet because she couldn't really move enough to do exercises, and it was so painful because of the pressure of the swelling. So as I opened up the vessels and worked specifically, we increased her range of motion that much. And then she was able to start strengthening and doing exercises and learning some other things that she needed to learn in order to be functional. So let's talk about how do we get specific in getting rid of the fluid after we've done the general body opening. So first, let's go over the opening. Because one of the advantages, right above your collarbone, you're just doing little depressions gently. Okay, we learned that in the last webinar. So one of the things that we need to know in order to get specific is what my body feels like, right? So if I don't know what my body feels like, it is really hard for me to know where am I really more swollen? Where is there more pressure in the tissues? And how can I kind of know what my body feels like? Well, one, you shower every day, so you get to know what it feels like, but be conscious of what you're feeling in your tissues, like, oh, that's a little swollen. So right here is my rib cage, okay? So I'm going below my rib cage. Right here is my belly button. So I'm above my belly button. I'm using this broad flat place in my hand and I'm going up. So again, this is a general way to move the fluid as I stroke up and no pressure down and stroke up. But if I get specific, and we went over that in more detail in the last video, but if I feel through my abdomen, I'm not finding a good spot here. Okay, right here, I've got a little more pressure as I feel around through my abdomen. There's a little pressure right here that it's not as soft, it's not as pliable. So I'm not digging on my abdomen, I'm not pushing really hard, I'm not looking for some mass or anything. I'm just noticing that when I get right here, it's just a little less responsive. It's a little stiffer in the tissues compared to the other areas that I've been working on. And I'm kind of slouching in the chair because a really good place to do this is a recliner chair, or even your bed with some, like a little pillow elevation, or you can lay flat and do this. But for the video's purposes, it's really hard to demonstrate this if I'm laying flat because the camera angle isn't good. So I'm going to put this broad place of my fingers. So I'm not digging on it and I'm not going to push on it. I'm just going to use a little pressure and I go, okay, right there, I can feel that little pressure. And I'm getting a little resistance from my body. So I kind of have to pay attention to that little resistance. And now I'm going to pay attention to where does that tissue need to glide. Now, do not copy my glide because that's what my body's telling me right now. You need to figure out your glide, right? So it can go in any direction. It can be, I need you to release pressure. I need a little more pressure. It should never be painful, okay? If it's painful, you're using too much pressure. So if you have swelling anywhere in your legs, you need to start here, go here, make sure my whole abdomen is flowing, because any fluid in your leg has to come back up through your abdomen before it can get back to your heart, right? So you've got to make sure that this area is open and flowing. And okay, so here's another little spot that isn't quite as, and I'm just gliding around on it, okay? Just gliding. Okay, and I eventually felt it kind of go. Whew. Now, again, how long it takes for yours to go. Whew. If you had knee surgery a few weeks ago, it may take a fair bit of unwinding movements before it goes whew, and really relaxes. If it's been chronic, like let's say you have chronic pelvic pain or SI joint pain or buttocks pain back here, because all of your back drains into this area as well, swelling wise, it may take a minute to 3 minutes or even 5 So it takes a little bit of patience to get in there. Again, I do this for a living, so it didn't take that long for my body, which you probably didn't want to watch me anyway. But if you want to work on yours, you can turn off the video, work on yours for a bit until you feel like, okay, because there are days that I feel my pelvic, feel this, and I go, oh, I have a little, there's a little thing right here I could work on too. So there are days that I feel and I go, oh, I have quite a, I have several spots today. There are other days that I go, like today, it's like pretty open and flowy. So once I've opened my abdomen and this line where your thigh attaches to your body, this is a good place to just do some little stretches here. So again, I'm not digging, I'm not pressing, I'm stretching my skin on top of the muscle underneath the skin. And I'm just stretching it up and kind of into my body cavity where all my insides are. And it feels really good, so I keep doing it. So I'm actually feeling, as I did that, I'm actually feeling a change of the sensation in my leg. So how do I get stuck fluid out of my leg? So the first thing I want you to do is find what your best normal is today. So in doing that, you're going to find an area of your body, because I'm using my right leg. And I'm doing that because I had right foot surgery a few months ago, and I still have some swelling in that leg and some fluid issues. So what do I want to feel? I want to feel my left leg. This is the leg that has, my left leg really doesn't have issues. But I want to just feel the texture of the muscles. If you're skin on skin, you can easily feel the temperature of the muscle. I'm going to feel in the back. And I'm going to notice, are there any lumps? Are there any ridges? Are there any bars or lines that I'm kind of going, oh, there's an issue that I might need to work on? So I'm feeling my better side or my best side first, because I want to know what's the density of my muscle, the texture, the all of those types of things. So now I'm going to go to my affected leg, which would be the leg either with pain, with visible swelling, with a recent surgery, with I just can't move it as well as the other side, those types of issues, right? I can't straighten out my knee, I can't bend my knee. Those are all issues that would be like, or my foot and ankle. It can be your foot and ankle too. So we're going to focus on your thigh. I'm going to put my camera down just a little bit further for you. Okay. So I'm going to start with big hands on the inside of my thigh. Most of your lymph, as it comes up your leg, is going to converge into this inside area of your thigh, okay? So, because this is where your big vessels are and a bunch of lymph nodes, so that that fluid can get in there. So you can use both your hands and just kind of bring that fluid around the leg, and then bring it around the leg coming from the other side. Okay, cool. And then I'm going to bring it up. Now, after I've stimulated the whole leg, because you should have been practicing that since our last video, right? So now I'm going to go back through and I'm looking like there's a little stiff place right here for me. So I'm going to hold my finger where the stiff place is, and I'm going to go slightly above it. So you can see that is very slightly above it. Actually, I'm going to go a little more above it from what I'm feeling. So I'm looking for the end right here. There's like a little change in my tissue, but it feels healthier above that change. So I want to be on the healthy tissue above where the stuck place is. And I'm going to do some little stretches of the skin on top of the stuck place. And what am I doing? I'm creating a siphon. Like, back when I was a kid, people would siphon other people's gas tanks. Now they put locks on them. You can't do that, thankfully. Okay, and they'd steal your gas tank. It's true. Okay, so now, as I feel back through here, I'm not feeling that little area that was kind of hard and a little bit tender. Now, I did not have knee surgery, but right above, so this is my kneecap. I'm drawing that picture for you. There's the kneecap. Right above the kneecap, there's a little area that does not have contractile tissue. In other words, there's no muscle there. It's just connective tissue, which is ligaments attaching your big thigh muscles, the quadriceps, into the kneecap. So I'm going to put my fingers there just kind of in a line so the padded parts are right above there. And I'm going to stretch that skin towards this area of my groin. Why? Because this can be a real significant area where fluid collects. So here's my kneecap and here's where the fluid will collect, right above it. And when the fluid collects there, again, you may look at your leg and go, no, it looks the same as the other leg. Well, keep in mind, you may have muscle loss in the leg that's affected. So that muscle loss can be taken up with fluid accumulation and swelling. The other thing that can happen is you just increase the pressure in those tissues. So you're collapsing the vascular supply. And now your nerves are screaming and you're not sure why am I having so much pain. And part of that can be this, that I have so much pressure in my tissues. So I'm using those fingers right above that kneecap area to stretch and open up those vessels and stimulate that fluid to come up towards the groin. Okay. Now, again, when you're just barely beginning these skills, you're probably not going to feel as many things as I feel, because I've practiced enough over 20 years that I can practically feel a water molecule between two cells. That's true. So don't get hard on yourself. It may take a lot of repetitions. In the beginning, I couldn't feel that well. Took some practice. But when you're aware of what's going on in your leg, like I can feel the top of my foot already, the fluid's coming up because I opened this up. So you also have the back of your knee, and in the back of your knee, we actually call this the Popliteal Fossa. Now, fossa means a space, a depression, an area of opening. So this area just loves to collect fluid. Oh my gosh. But what it does is it keeps you from bending your knee. It can also keep you from straightening your knee, because the reason why we have this fossa back there is because it allows better range of motion in the knee and more mobility in the knee. But if I put, like if you put a big pillow back here and tried to bend your knee, you can only bend it so far. Now, right now you have an internal pillow, a swelling that could keep your knee from moving well. So we're going to do what I call the scoop, which I use my fingers behind my knee and I scoop up. Now, as I'm doing that, I'm also noticing, are there areas that feel more firm? So I actually do have kind of a firm area right here. So I'm going to go above it because I want to open it up and create that siphon and pull the fluid out. So I'm never using force. I am only using pull, because water works fabulous with pressure, right? If you reduce the pressure up here, this fluid is going to go the path of least resistance. So I'm pulling that fluid up and out. I'm not shoving it. I'm not forcing it. I'm not putting weights on it and trying to make it go, because if it doesn't have a pressure to pull it or to encourage it in a direction, it's going to sit there and stagnate anyway. And all you do is stress your tissues more and create more pressure in the area, which creates less healing. So when I pull this up gently and I feel my thigh opening, so let's say I had a line across here, I could come above that line too, right? So now I'm coming back into that space. You can feel two tendons. So there's two tendons on each side, and then in between those two tendons, you actually feel like a little bit of a more depression. And that needs to be open and free of glop, as I call it. The medical word is thixotripsy if you care. But it's really where you've got things like proteins and white blood cells and things that you don't really need. They were important during the time of trauma, but they're not important now because they really aren't helping your healing anymore. And we need to move that out. So we're going to do those strokes, getting nice and into those. Now, you're not going to force your way in there. You work down through the layers until you can really get into those tissues. So if you have an ankle or a foot problem, then I would come into the calf. Now, even with a knee problem, there's lots and lots of knee problems I've worked with frequently, if not always, but close to always. The calf muscles also get swollen because this is all gunked up. So we can't get this flowing. So I just come down into the calf. And again, it's a drawing up of this direction. So I use stretch of the skin on top of the tissue underneath. Gentle, gentle, gentle. I'm not digging into the muscle. Stretching the skin on the tissue underneath. And when the stretch stops, I reposition my hands. But when I reposition, there's zero pressure. So I'm in slight contact still, but there's no pressure going down. Then I'm coming into the ankle, and I'm doing behind the ankle. So most of my foot is going to drain on the inside, meaning the arch side of my foot, and I literally will just take it in my hand and kind of roll it in to that inside of my leg. Because the more swelling you get rid of and the more ease you have in your tissues, the better you're going to be able to heal and the faster you're going to be able to heal. So you want to keep breathing, drinking your water, working on your lymphatic system whenever you have a chance. Again, there's specificity that I can't really teach over a video because it's one of those things you kind of have to be able to feel and practice with some guidance. But the more you practice and the more you feel your tissues, the better you're going to be able to support their healing even from your own home. So keep working on that. And getting rid of that swelling so that you can prevent more damage to your tissues by needing more medical procedures or by having a lack of healing because there isn't good circulation in your body and because, yeah, the lymphatic system is a return circulation system. It's a one-way valved fluid transport system. So it takes the fluids from out here up into here. So you can work on this for 5 minutes. You can do this for 30 minutes. You can even do it for an hour. It just depends on what you can do. Just fit something into your day somewhere where you're working on yourself and supporting those tissues healing. My name is Mary Thomas. I'm a physical therapist, and I wish you all the best in your journey to wholeness.